Hi guys, my name is Ore. Thank you so much for being back. So amazing to create content for you.
I had so many role models within my family, and not everybody has that.
Yes,
And how
absolutely.
important it is to be part of the community for others who may not have that built in.
What would you say to a Black professional who may aspire to be in your position or something similar and they don't have those opportunities in their home or within their network?
Don't be afraid. And I think that you'll find that people are also happy to share. Like, we join these organizations because we understand how important it is.
Yeah.
And look for allies too, and they may not be Black, but if they're interested, they say, I want to help you, do lean into that.
So just kind of highlighting, the month that we're in and just like the severity of the importance of this month. Studies have often highlighted a representation gap and systemic challenges for Black women. You're a woman and you're in this kind of profession that is sometimes male heavy. And, we're in Canada, it's a place where we haven't always highlighted that group of individuals. So during periods in your career where you found yourself without peers of similar background in leadership, what was your internal dialogue that reinforced your commitment to remain at the decision-making table? Because I think it's so important for Black women and Black males, Black individuals in general, to be at decision-making table. So what kind of reinforced your decision in those moments?
Yeah, I think a lot of the times was looking around and thinking, wow, there's not even a lot of women at this table. It would start even, forget laying in the intersectionality. It would just start even with looking around and thinking, wow, there's only one or two of us as women at this table, let alone layer in any racial differences, any other differences, any other things. It was just like, whew, that's really, and that I think pushed me. I thought, man, this needs to change. We need to talk about this. And I think, for me, it pushed me to learn a lot about the different ways we show up. Mentorship is very important, especially earlier on, in terms of, showing you the ways, showing you what's out there. But then we have to go beyond mentorship. We need to move to sponsorship. And I think that is very important. And sponsorship is when you have the ability to say, you know what, I have a lot on my plate. I can't do this, but you know what? I have somebody for you.
Yes.
Let me recommend this person to move into this route. And that's really important because that person may not have naturally, by the structural bias that there is and systemic bias, may not have been chosen, but somebody else just talked to someone that they knew. So you have these, now that you're in these rooms, we have these abilities. And that's what I think of when I'm too busy and there's something that's coming up. I say, but let me recommend a few people who will bring something similar as I would to this table. They'll bring the vibrancy, they'll bring a lot of different lenses. They will have very similar, thoughts, and not even thoughts, but like just similar in terms of the diversifying the thoughts at the table. They will bring that similar diversity that you're looking for. Give you these instead of going back to just what else is already at the table and bringing more of that. Here we go. And I think that's been important because it's played a role for me, even for some of the roles I've taken on. Someone said, you know what, I don't have time for this, but I think that you would be good. And sometimes you might not have even thought to apply for something or thought something was, out of your reach. And someone says, you know what, I think you should apply for that. I think this could really be great for you. So that's one of those moments. And so we have to look for those opportunities as well. And sitting at those tables, I think about that a lot. And it's impressed me. And I do look around, I'm a Black allergist. I'm a Black female allergist. I could tell you if someone sees me in my office and they say, oh, I saw another Black female allergist. I know who they're talking about. There's only a few of us in the province. And so, just thinking like it's important to continue to build so that if you told me you saw a black allergist, I'd be like, oh, could be anyone. I want that moment where I'm not like, oh, there's a list of 10 people I can think of, you know? So I think that's, I think about that every time I'm at a table and thinking, okay, and I sometimes call it out too. I say, this policy that we're talking about, by the way we've done it, it actually leaves certain people out. Have we thought about that? What I think, the pandemic had a lot of negatives, but let me tell you, it opened up with allowing people to participate more. And this sounds crazy in one sense, but we'd always been pushing for more virtual. We had been trying to do that pre-pandemic, especially things like meetings. It was always so hard. They were always in the mornings before people had clinic. Unfortunately, a lot of women do a lot more in that kind of early preschool time. And would find it hard to get to the hospital or get to the meeting spot in time. After they've gotten kids kind of, settled. So with the virtual meetings, really pushing to say, we need to keep this because it allows more people to participate. And it allows for that. So then you can just actually stay in your home, finish this meeting, then come in or work around it. And I think that that's been really important, talking about lived experience when people apply to professional schools, because not everyone volunteer in the summers. A lot of people have to work because it's a privilege to be able to volunteer, so many people have to have jobs while they're in school. So having kinds of discussions saying, if we put a very heavy burden on the importance of volunteerism, are you willing to accept that we'll only get certain privileges or class, like privilege, applying? Because that's what you might be inadvertently doing. Have you thought about that? So it's sometimes challenging, and people don't even mean to do it in a negative way. They're like, oh, I never thought about it that way. So really taking those opportunities to talk about that.
Oh my goodness. This conversation has been so inspiring. I have a couple of last questions as we kind of like start to close off, but you mentioned a couple of things, and I think this last question, is going to segue us really well into this next question I have for you. So, you talked about sponsorship at the beginning, and you talked about allyship. And I think one of the key things that I notice is from 2020, when I first came to Canada, to now, I have seen an increase. So I celebrate the increase in representation that I see. I celebrate the changes that we are seeing: more Black people leading and more Black people at decision-making tables, and more allies coming to the understanding of what we are saying. And I think sometimes allies may feel like, oh, I'm not Black. I'll give an example. We have a Black Pharmacy Professionals of Canada conference coming up this February. And one of the things that I think some individuals may be thinking, I'm not Black, maybe I can't go, maybe I'm not welcome in that area because it's to celebrate Black people, or maybe Black History Month is just for Black people. What are the things that allies can do to support this movement, to support Black professionals, to support Black youth, to support Black students who are in professional programs? What are some of the things that, they can do? Sponsorship is one of them that I will just highlight there. So you mentioned a lot of different Black associations: the Black Physicians Association of Ontario, we have the Black Physicians of Canada, we have the Black Pharmacy Professionals of Canada, there's like Ontario, I think they're called Canadian Nursing, Black Nurses Association. So there's so many different organizations that allies can sponsor. You talked about some important things like getting that data. So many organizations need sponsorship in order to collect data. Do we know how many Black women are getting breast cancer? Do we know what needs to be done to help those kind of individuals? So what are some of the other things that allies can do to continue to support our race?
Yeah, I think, it was one of the first things that you said was sometimes people feel that they maybe can't attend something. And actually, that is your act as well. When you come and hear, and you can hear about the challenges, because you never know when you could be part of the solution to say, actually, I could connect you. This is something that you guys are talking about as a major issue. That's attending, the Black Pharmacists Association, saying, hey, this is something you're dealing with. I think I can connect you, because sometimes what we need is that connection. That's part of that sponsorship, bringing us into the room. So what I would say for allies is, yes, you're doing great things, but
Yeah.
come to our organization conferences, educational events. Come and hear about the issues, because you never know when you could be that connect away from us solving some of the issues that we are currently facing. You could connect to helping us get more race-based data for various, disease entities or employment, and showing how race is affecting employment, or how to maybe link us to say, can I link your association with the Secondary Schools Association of Ontario, because I
Yes.
want to just have more of that diversity of people, so that from secondary school, primary school, they're thinking and seeing different professions being open. I would say that, and I would say, if you're ever questioning, should I be here, or what can I do? You know what? Ask. You've done, a lot of people who have done work being allies, and I think we're seeing a lot of strong allies now.
Yeah.
It's not about just putting on a label. They're really stepping up. You've also gained our trust, and you can have frank conversations to say, is this a room that I could be helpful in? Is this a space that I could be in? Are there spaces that you're looking to be in? And let me see if I can connect you. Because sometimes it's the connections that they don't even know they have, that they didn't think about till they hear about what the issues are. So don't be afraid to come and be part of the conferences. I recently went to the Black Physicians of Canada conference just in the fall, and it was so great because we had many powerful allies there, and that was very important. And they said, we want to make sure we're here listening to the issues. They were talking about, some of the support programs. These are, some of the larger organizations. And they said, we're thinking about how to support physicians. And this is great to know. Burnout hits differently, especially when you start laying in the cards of race, et cetera. And what are we going to do to kind of try to support that? Or can we support the programs you're providing for Black physicians to ensure, to say, we offer this, but we also know there's some programs through the Black Physicians of Canada. So there's a lot of opportunities, and you may not even know where you could connect and move us forward. Come into the space, and don't be afraid to have frank conversations. We're very open to that, and we're very happy to say these are the ways that we're looking for help, support. Sponsorship.
Yeah, I love that you said that. And I think, I can summarize that as just listening. So just being an ally and actually just listening to what those organizations and individuals need. So thank you so much for sharing that. Just 2 final questions for you. Your background includes work with Black Scientists Task Force on Vaccine Equity. Now, 2020 was such a wild year for so many of us for many reasons. But I think I find that, one thing I encounter as a pharmacist daily are our people, just maybe the lack of knowledge is causing us more harm than good in terms of just our health, right? I have come across patients who are like, oh, so-and-so told me not to take this medication because it's not good for Black people, and this happens and that happens, and, they end up with a stroke, or they end up with other kind of serious issues. How are you using your platform as president to address the healthcare mistrust, especially within, the Black community? Because that's such a huge area and I think the more we see more Black professionals, maybe there will be an increase in that trust. But how are you using your platform to address those healthcare mistrusts that still exist within marginalized communities?
Yeah, I think, like you said, 2020 was a time. And honestly, when we came together for that Black Scientist Task Force, this is one of the things we really talked about. And we talked about how people have also forgotten some of the history, some of the most important work. When you think about actual initial vaccines, you might people will say names like Pasteur and all these, and some of the work done there. But if you go back in the textbooks, they talk about some of the Black slaves that were brought into the United States, and how they noticed that they were actually doing pretty well against smallpox. And that's because they had learned to, pick some of the scabs from and then really inoculate themselves as a form of vaccination. And that's how they were seen as being more hardy. And that is actually, and then they started doing that on a larger scale to protect the populations in mass. and how this is actually some of the things that is actually within our history. And then we have to remind people that there was a time when in times of slavery where they said, for the Black people are so hardy, they don't need medicine, they don't need vaccination. And to remind that we fought to be able to get that. There was thoughts that we need less vaccines or less medicine, less pain medication. We're still fighting that one.
Yeah.
So how important it is that we fought to get where we are. And I really try to engage in those. And I'm very open about, there are times where there has been mistrust with medicine, and, Tuskegee, we cannot ignore that. And that happened, and we have to talk about it. And that's what we addressed that. We said, straight up, this is something that happened. We're not going to poo-poo this. We're not going to go around it. But to talk about it, but to say, part of the most important thing for us is our existence sometimes is a form of resistance. And so it's important for us to find the best ways to keep our community alive and well.
Yes.
Because there has been a lot of, work against that. And, it is important to talk about hypertension. Is it more prevalent in Black populations? Yes. Why? Not because we are different genetically. Actually, we're not. But systemic racism has put Black people at higher stressful times, that it has actually changed us over time, where we're constantly in times of stress, and has built more in essential hypertension in Black people. So it's really important for us to address this and to ensure that we do monitor for it, know that it might appear earlier, and treat it. And yes, sometimes there's some racial variances. I'm sure you talk about this in terms of certain medications, but talk about it. Ask someone first, because we know online there's no vetting. There's no vetting in the WhatsApp groups with different people, unfortunately.
Yes.
So that's also why it's important in medicine and any medical professional, pharmacy, doctor, nurse, to have an area of trust where you can say, I read this or I heard about this. Is this real? Have these conversations. And I think that's why it's more and more important that we have areas that you can get trusted information. Because yes, there's things too that have happened, but there's also opportunities for us to take charge of our health. But let's do it in an informed way. And just because it's online does not make it true.
Oh, thank you so much for that. That last statement is so key. Just because it's online does not make it true. And also just asking questions is so key. I think sometimes people just don't know, like, oh, maybe I can't ask a question. Maybe I'm too scared to ask my doctor or my pharmacist or my nurse the right questions. But that's so key. This has been such an inspiring conversation. And I think my audience and other people who will come across this will find so many key takeaways. I have a final question. There has been a long, complex dynamic between pharmacists and physicians, especially in Ontario, and as a proponent, of interdisciplinary collaboration, what specific advancements or shifts would you like to see in that pharmacist-doctor relationship? I think that we have such a great opportunity to collaborate, and collaboration is so key. So what kind of changes would you like to see in the coming year?
Yeah, thank you. And thank you for that question, because, sometimes it seems very almost contentious, but I think, what is important is that we don't get pitted against each other. I think that there's a lot of room for collaboration. One of the things I think Ontario is missing for us to have that great collaboration is really that digital health infrastructure for us to share information, because that is missing. And then what happens is there's fragmentation in the system, and then that leads to frustrations all around. I would love to see more access, even for myself and my pharmacy colleagues, because, as an allergist, we run drug allergy clinics where I might remove certain medications from someone's repertoire. And I would love to have more collaboration with, it'd be like, okay, who is your primary pharmacist that you go to? Yeah. Can we have some conversations so they can also tell me what other options are, other chemical structures we can consider for these entities? Like, that would be great. But our healthcare system isn't set up for that. It's really, they see me and then I give them a piece of paper and I say, please share this. And I give them a letter for their pharmacist. How many times that makes it there. There's not an easy way for me to share what was done in the drug allergy clinic with the pharmacist. And I would think that's a really important person to know what happened in this. And because some of these labels aren't removed, right? And then that they come to you and you're like, whoa, you're giving all kinds of medications, but there are all these flags here, but we don't have great ways to communicate. So I think having some of that would actually allow us to be able to work better. There's a lot more kind of siloing versus we need to be more in a sharing context so that we can work more together. You know, so many family health teams that have access to the pharmacists, that have them at the table to talk about certain medications and how to like optimize health. It works really well. And I think we all want more of this team, but it's got to be teams where we can talk to each other. And right now, the way it's set up in the province, it's not really pushing for us to talk to each other and to share care. It's a little bit more separate. And I think that's why everyone's so frustrated, because there's not a focus on the integration and the digital health infrastructure to allow us all to succeed.
Yeah, you have spoken on so many areas that have really tugged on my heart a lot. And, you know, as someone who's coming from the National Health Service, the NHS in the UK, and seeing what we are doing there versus how things are being done here, I think we have so many great examples that we can use to basically create our own kind of like setup or what will work for us. And I think that's so important, being able to create trust within ourselves as professionals and then building the trust with patients that, you know, I know my medical team have it covered. Oh, I've seen a hepatologist, I've seen a immunologist, I've seen this person, and they all have that information about me, and I know as a patient that I can trust that they are creating the best care plan for me based on the information that is shared between them. So thank you so much for sharing so much knowledge and information. I am so grateful again to have you, and I am so confident that this will find the right people and the right audience will be able to make the most of this information. Thank you again. And I am hopefully looking forward to meeting you in person one day and hopefully connecting a bit more. Thank you very much for your time.
Yeah.